Welcome to the International Journal of Paramedicine podcast. I'm Mick Gunderson, the editor-in-chief, and today I'll be speaking with Dr. Raphael Barishansky to discuss his editorial entitled Ambulance Deserts, a critical challenge for EMS leadership in achieving equitable emergency care access. This paper appears in IJOP issue number 11 for July-September of 2025. Now, most of the manuscripts published in IJOP have an associated discussion thread on the NEMSMA email listserv, which is hosted on Google Groups at groups.google.com/G/NEMSMA, NEMSMA. You're invited to go there to ask questions and make comments about this and other IJOP papers, as we want to get you and other paramedicine professionals participating in scholarly conversations about these papers to help advance our discipline. Our editorial team will then curate the best parts of these email discussion threads so they can be published back into the dialogue section of the journal, which is our version of the traditional letters to the editor section. If your question or comment is selected for the dialogues, you'll be officially cited. So please join in and make your voice heard as a paramedicine professional. And here's the interview. Welcome, Ray. Thanks for coming on to speak with me about your editorial.
It's great to be here, Mick. Thank you for having me.
Sure. So to get us started, tell us a little bit about your background.
So my EMS journey actually started like many. I was a volunteer, volunteered in northern New Jersey, in Teaneck, New Jersey. Volunteered for a couple of years before I was bit by the bug immediately. Let's get real. But picked up a job about 3 years in Newark, New Jersey. And my joke is that Newark is the type of place where they give you the test right before they teach you the lesson. Picked up some degrees and had some managerial positions, including Hudson Valley Regional EMS Council. Bumped back and forth between public health and EMS a little bit in Prince George's County, Maryland. Then I was the state EMS director in Connecticut. And my last full-time position was as a deputy secretary of health with the Commonwealth of Pennsylvania. And also picked up some degrees along the way.
Well, very good. So on the topic of the editorial, what exactly is an ambulance desert?
So that's a great question. An ambulance desert is a location where people are more than a 25-minute drive from where an ambulance is stationed. And what's really interesting is that I first saw this definition in a 2023 study by the Maine Rural Health Research Center. And I thought to myself, this is really interesting because even though people who've been in EMS for a while, like me and you, know that there are places like that out there, I think, and I'm worried that I may be mistaken on this, this was the first time someone gave it a name. And when you give it a name, you can study it a little bit better.
Yeah, no, that makes perfect sense. Although I must say the 25 minutes seems a little bit specifically arbitrary, but that might be the topic for a different conversation. You saw this particular paper and the definition of an ambulance desert. So what was it that prompted you to write an editorial about it?
So it's kind of interesting because I've always kind of tried to look at elements and areas of EMS that people might not look at in depth. And a lot of times that kind of puts me in a unique position. So a lot of times I look at public health and EMS interaction, and I look at public policy issues. And so about a year and a half ago, I had an idea for another article, and that was about EMS as an essential service. And I'll tell you, your audience, this, that I felt like there was a lot of voices in the echo chamber, all agreeing that EMS must be an essential service and everything that goes along with it. But I felt like people outside of our echo chamber really weren't grasping the importance and the realities. So I wrote an editorial about that for Governing magazine. And then I saw this main paper, and I wrote a similar article for Governing magazine, but I felt like it was lacking. And what was lacking from it, Mick, was the EMS specifics. What can EMS leaders, and as I use the term leaders to be, actually do about ambulance deserts? So the Governing article was for policymakers and elected officials. But at the same time, we need to have our own game plan. Remember, we're sharing the echo chamber, but we do need specifics in regard to a game plan.
Sure, that makes perfect sense. So Let me then follow on with what causes these ambulance deserts to develop in the first place? How does this happen?
So it's really kind of interesting. One of the things in the article was I think somewhere in the title they put the word rural, and somebody on social media, as happens, took me to task for the article and said, this doesn't only happen in rural areas, and I agree. But I wanted to put a fine point, put a focus on it. And when we look at underlying causes, there are myriad. There's obviously the chronic underfunding of EMS. There's a workforce shortage, which could be the topic of another podcast. There are public policy issues like EMS as an essential service and all that comes with it. But there's another element that I think is also really important to focus on, and that's what I would call like the cost of readiness or the cost of preparedness. EMS agencies are out there 24/7, 365 with resources, but the thing that we get reimbursed for isn't happening 24/7, 365. And so here we are with this strange gap, which many have studied before me, and I won't go into specifically, but we're in this strange gap between what we're funded for and what we're actually ready for. And therein lies one of the other causes of our ambulance deserts.
What could then be done to reduce or eliminate this particular problem?
So I think that we need to take a. It's interesting because I mentioned the Governing Magazine article and how that had one game plan or path. And I think that we need to, as EMS leaders, have another game plan. And we need to, I'll go into specifics. First, we definitely need to understand the public policy implications of EMS. And so when I say that, I'm specifically speaking about EMS as an essential service. And I don't just mean a paper designation, as some states have. I mean a designation that includes specific statutory language about what I call form, function, and funding, or form, function, and financing. Secondly, we need to really look at statewide EMS sustainability plans. There were two that I highlighted once upon a time, and one was Maine. They had a plan for a sustainable EMS system, and the other one I think was in Minnesota, where they actually came close to declaring EMS as being in a state of emergency in previous years. So I'm sorry, I'm from New Jersey. I speak with my hands. So I'm going to hold up two fingers and say, so for right now, we have the public policy issues, AKA essential service, specifically EMS sustainability plan. We need to address that, for lack of a better term, that cost of preparedness, that cost of readiness. We need to be able to build that in, and that readiness, which speaks to staffing, equipment, and even training, is really important. All the more important because we only get funded for response. We need to expand Medicaid as much as humanly possible, and that includes treatment in place, and it includes transport to alternative destinations. And last but not least, we need to strengthen and sustain our EMS workforce. We hear a lot about recruitment and retention. We hear a lot about the EMS workforce in jeopardy, but we need to actually partner with traditional and non-traditional agencies. We need legislative support for this, and we really also need to focus on one additional area, which is something I wave the flag on a lot, and that's leadership development. If I could stand on the soapbox for 3 seconds, it would be that most of the EMS leaders who I've met have had to pursue their own leadership development or professional development through their careers. I believe it was Greg Margolis, I hope he's okay with me quoting him, who once said, every good EMS leader is an autodidact. I had to look that up just to let the audience know. But I will take that with me wherever I go. So, but it shouldn't have to be like that. We should have a structured professional development plan as a part of this. So I just gave you my general.
Medicaid, Medicare, all those sorts of things and our funding mechanisms are issues we have here in the United States. Is this a problem in other developed countries around the world?
So it's interesting because I think we see it in limited areas in other countries around the world because a lot of other countries have different systems set up. that are obviously different than the United States, different in regard to funding, and then funding bleeds over into the cost of readiness and cost of preparedness, different workforce models. But at the same time, there are areas where that ambulance desert definition comes into play. And so some of the ramifications of what's going on in the United States and potentially some of the solutions that we may be looking at definitely have impact on systems outside of the United States as well.
It's amazing to me how short-sighted and narrow sometimes we are in the United States about looking for solutions outside of our borders. So that's why I wanted to bring in more of a an international flavor, if you will, to the conversation, because there is so much that I learn, and I think we can all learn from looking at how other places around the world have developed their EMS systems, and take a few pages from their manuals. So in closing, Ray, any other comments or things you'd like to say about this topic?
Yeah, I think that when I look at topics like this with the significant public policy implications, I always want people to, or leaders, excuse me, to look at it and view it as a call to action. This is something that's impacting all of our, well, I believe that the study from Maine actually highlighted that this was happening in 41 states, but it's important to recognize that I believe they only heard from 41 states when they were doing the study. So, logical inference there, it could be happening in more than 41 states. But I think that we need to look at this as a call to action. And what you had mentioned before about the NEMSMA listserv, I hope I got that correct. I would love to see the comments there, because I think some of my best feedback on articles has come from people who have ideas and have made things work in their areas, and other people can take from it. And additionally, we can take that and hopefully bring it to other areas across the United States. But yeah, I would look at this as a call to action. I think that we all have a vested interest in making sure that we address areas like that. And I just hope people step up.
Well, thank you so much for doing this interview with me, Ray. Please check out the full manuscript of this paper, which we'll have in the bibliography, the citation for that main paper, and a link that Ray was referring to. And that, again, will be in the July-September 2025 issue, number 11. And then go to the NEMSMA listserv at groups.google.com/G/NEMSMA to ask questions and make comments about this paper. We also invite you to subscribe to the IJOP channel on YouTube and your favorite audio podcast platform to watch or listen to other interviews, abstract presentations, and IJOP content. So on behalf of the National EMS Management Association and the entire journal staff, thank you.